Welcome to another episode of the Bleeding Edge of Digital Health. Real exciting technology to feature for you guys here today. We've got Steven Scott, CEO and President of VitalTech, joining us. Steve, thanks for showing up today.
Thanks, I appreciate it. Thanks for taking the time.
Yeah. I was excited to dig into the technology a little bit. I think chronic care management and care coordination are exciting technologies these days. This is going to be definitely one of the verticals that I think is going to be at the forefront of digital health here over the next couple of years. So, and I know you guys have an exciting solution for a number of existing problems in the ecosystem currently. So, definitely want to dig in here. If you can, let's get started by just having you kind of I like to have guests tell the origin story of the technology and kind of, how the company got started, but also how you got involved.
Sure. Yeah, the company actually started about 5 years ago and originally started in the hardware side of the business, looking at creating a wearable. I think they were contemplating building out a watch and a baby monitor at the time. And in the process of doing that, they started to look for software to data aggregate the information. And that was really the impetus for building out the SaaS platform. They couldn't find the software to do all the things that they wanted to do, and we'll get into that a little bit more of how much more we do it besides just data aggregate the biometrics. So from there, it just kind of grew and grew. And then as the wearables, I think as everybody's seen the industry and the giants came in, they really shifted more and focused on the SaaS platform, and that's what we do 100% today.
Yeah. And how'd you get involved?
I had just left an healthcare analytics business up in Boston. We had sold it and transitioned it out. And then some of the investors who were looking for how do we take this to the next level and actually run it from transversing from a software or a hardware platform to a software platform. I've got a pretty extensive background, especially around the senior housing, chronic care management, and it was just a good lineup at the time that they were looking to kind of how do we continue to grow the business and really get deep into healthcare.
Yeah. Chronic care management and the elderly population it's a complex market. I'm dealing it with both of my folks right now. Both of them were in the hospital simultaneously at the last year at one point, and still dealing with it. And there's not an easy solution to the problem, but it's good to see that there's a lot of time, energy, brain space, resources, money going into this field, because it's definitely a complex problem that needs to be solved. So before we get into the tech, and as we talked, I definitely want you to, kind of give a static demo of the technology so that the audience can see exactly what you guys are doing. But talk a little bit about the use case and really what's the problem you guys are trying to solve, and specifically maybe some of the disease states that you're trying to address.
Sure. So, we we participate in the digital market, and within that, it's the virtual care realm that we're really servicing. And that is as services are getting pushed more and more to the home, and people are looking for early indicators of what's going on. And as people are aging, right, and the age wave hits, the number of chronic cases that come up or the chronic disease states that come up. And when you say chronic disease, you're talking about diabetes, hypertension, cardiovascular, CHF, COPD, kind of the big five, the big seven that affect it, a vast majority of the population. How can we get ahead of the sentinel event that's going to happen at some point in time, right? If you have heart failure, you're going to gain weight, you're going to have trouble breathing. How do you get ahead of that and do that? And as services are coming more and more into the home, how do you get its insights into what's going into that area? So those are kind of the focus of what we're trying to do, is now that the capabilities and the technologies enables you to gather that information out of the home. The disease states are the growth of it with the age population that's coming on now. How do you get ahead of those sentinel events and be able to keep them from going to the emergency room? Keep them interacting with the physician, taking their medications, watching what they're eating, and kind of tracking that over time, right? So all those different disease states, you need to do those exact same things, whether you're monitoring your weight for fluid retention or you're measuring your blood sugar levels and your nutritional intake, to make sure that over time you're trying to get the best care and the best proactive measures you can do versus having some kind of a sentinel event, going to the ER, most likely get admitted to the hospital, spending a couple of days there, getting your meds changed, coming back to home, and not realizing kind of you could have gotten ahead of that by simply, one of the best use cases we talk about is, I live in upstate Wisconsin, it's Oktoberfest, I have CHF, I'm out at Oktoberfest, I have a couple of beers and I eat some sauerkraut and I eat some bratwurst,
Right.
right? Probably the two worst foods that you could have if you're CHF. So your sodium spikes, you gain weight, that weight doesn't come off, and then so you have a care coordinator who sees that data, or you see it as an individual, that I increase my Lasix, or there's other measures that you can do, instead of going to the ER, hey, I can't breathe, right?
Right.
So if you can get ahead of that, and if you can use those, the biometrics is what we call it, but those are really, from a business perspective, leading indicators,
Right.
right? So if I've got information and I know what's going on, I know my disease state, and I can measure that and trend it over time versus one episode, then I can intercede and I can do things that can really affect the ability to improve that outcome or prevent that utilization of the ER, or maybe I'll just need to go to see my doctor and he could have given me the up my prescription for a short period of time, or how do I intercede before I get ahead of that. But if all those different disease states, all those different chronic conditions that we know, the big seven, all are applicable for what our platform does.
And it's not only just there's not just an RPM component to it. It sounds like there's a predictive component to it in terms of this trend line is going
Yeah,
into the negative. If this continues, this is going to ultimately end up, this person's going to the ER, or they're going to end up admitted in the hospital with a longer term stay, et cetera.
yeah. There's components of when you're in a disease state. There's clinical pathways and care guidance that says, hey, look, you're looking for those trends over time. So when you start to see this, intercede, right?
Mm-hmm.
And it can happen in a couple of different ways, whether from a patient engagement education perspective or trending over time. Weight's a great example. You gain 3% over the last week of weight. What's going on, right?
It's
There's
probably
no,
not just
yeah.
gaining weight, right?
Yeah, you're not getting away. You're retaining fluid, so you're stressing the
Right.
heart more, and now you can't breathe as much, and your energy level goes down, and it starts to compound, right? Or you're taking your medications all at once, and you have hypertension, and you have some other things going on, and an hour and a half later, you stand up to go somewhere, and you faint because you've had syncope because you take all your blood pressures at once, and medications at once. So maybe you need to spread them out over time so that the impact isn't so great all at once, right? But unless you're
Yep.
measuring that, monitoring that, and you're watching it over time, how do you know to intercede like that? So
Right.
um, there is some the clinical pathway, the guidelines perspective to do that, looking at the analytics to do that, and there's some of the more the AI part of it is really on the front end of when you have that disease state, what kind of pathway are you going to follow, right?
Yeah.
And what kind of cohort and how soon should you be enrolled in that pathway?
And so let's take a look at the technology. Let's go ahead and have you pull the presentation up so that we can all kind of
Yeah,
see what you guys are talking about here. And
sure.
as you're walking us through this, I know you'll get into the different components of the program, but is this something where you guys deploy this for the provider, and then the provider they manage all the backing clinical support, right? You guys aren't
Yeah,
involved in that side of it. It's just basically facilitating all of that, right?
right. So let me bring up our first slide here, which is kind of the cloud platform they are. So we are a SaaS-based platform. We utilize the cloud in order for people to access the program, right? There is an application that the patient can you put a lot on their device. 99% of our clients actually use a tablet that we provide in our kit that the peripherals will hook to, and that tablet's the main interaction for them. That will aggregate the data usually via Bluetooth, though we do have some cellular connections for
Mm-hmm.
some cellular devices. But the information, and we'll just start at kind of the right side of the spectrum here on the Vital Care side, where it says user. That's the little tablet that they're using. They download the application or it's preloaded on the application for them. Their
Yep.
devices are connected in through there. And then as they're going through time, they can monitor through the devices. You can actually video teleconference with the caregiver who can, or family member. If you see down the bottom, there's an aspect where the family can connect in and be involved, or whoever you want to be involved in the coordination of your care.
Yep.
Then that middle platform is actually our portal in which if you're involved in a physician's practice that's actively managing your condition, if you're involved in a hospital health system on some of the ACO arrangements or some of the delegated risk arrangements on the value-based side, where you'll
Yep.
have a care coordinator working with you, a case manager working with you, that's how they'll actually interact with you on the platform. So the device and the application, and there's a portal component to it from the care coordinator sides that work. All that information goes into the cloud, then comes back and is presented to you in the application. So I can show you real quickly here. There's a slide shot.
And
If you're
while you're pulling up that next slide, so you guys, just so everybody understands, you guys, once you get the provider on board that, hey, they want to roll this out, when they say, hey, Mike Moore is a patient of ours, we want him in the program, you guys ship a kit out. It's got the tablet, it's got whatever wearables that are necessary to be able to capture the biometrics that provider wants to see in their dashboard. And then all I got to do is just take it out, turn it on, put my whatever it is, Fitbit on or whatever
right,
monitoring devices, and then everything syncs up with the tablet and goes up to the cloud.
correct, correct.
Oh, that's
Yep.
incredible.
Yeah, that's the vast majority of our clients. That's exactly how they would like to. That's how they want to run their program. There are a few clients that we call BYOD, bring your own device, whether it's an Apple phone or an iPad or their own tablet that they connect into. And then they may use an LTE peripheral. When we mean by LTE peripheral is a glucose monitor that has a cell card that then connect to a broadband network, and then that data would come into on the back end and present on the app that way. Um,
Mm-hmm.
but the vast majority, because we deal with most of our clients are not single focused disease state. They're managing the
Right.
whole patient. They're looking at people who are multiple comorbidities. I heard polychronic the other day as one of the terms, but 3 or 4 different conditions, and usually like diabetes and hypertension. There seem to be a
Yep.
lot of other people on the platform with that, people focusing on that. Closely, CHF is another one, and then we're seeing more and more people with COPD come on the platform. And a lot of that has to do with the peripherals that are coming out to market now that are much, much better from the connectivity perspective, which is something that we don't really talk a lot about. People get so fixed on the technology and the app, is this only works if you're able to connect, right?
Yep.
So, Wi-Fi you can connect if people have in the house, and more are doing that. The broadband connections and the footprints across the country are much greater. We have a relationship with AT&T that allows us onto FirstNet, which is their EMS system that enables people, and it has the best coverage of any cell network in the country.
Yep.
So we can access the rural market now as well as downtown inner city. You live in a concrete building and you can still get a signal. So those are the potent components to be able to do that. And then how you want to interact with the patient, how the patient wants to interact with the technology. Predominantly, it ends up being through the tablet that we see today.
Yeah, that it's an interesting point you make, and I've said this a couple of times in over the last couple of months. We saw a huge influx of money into the digital space over the last 3 years, and as a result of that, a ton of technology has entered the market, both wearable and software. And if I look back on that, I think the biggest, because I always try to think why now, why did all this stuff just like all of a sudden it was like overnight, and I really believe that the introduction of 5G changed the game. I think,
Absolutely,
yeah, I
absolutely.
think that,
It
like, to
was,
your point, the availability of 5G and the broadband, it's been a game changer.
yeah, it definitely has, and as it gets better and better coverage across the country, and it's accelerating, it absolutely will. Both from the types of devices that can deploy and the amount of data that can go at the same time, right?
Mm-hmm.
So, very big impact, but doesn't get talked a whole lot about in healthcare,
Yep.
but will become more and more. And I think the impact that that has on hospital at home and those hospital home programs, and as the FDA devices that now can only be in an acute setting that are getting certified to be at home, right?
That's
And
right.
to stay at home full time versus having to be deployed, set up and in and out of the home with a nurse or a certified person to do that. All of those things are accelerating rapidly because of the improvement in the broadband connections.
Yep.
You know, it's the
Absolutely.
biggest enabler we have.
I
So
agree.
yeah. So what I have up on the screen here now is what the patient sees when they turn the platform on, and how they access the different components of what the platform does. So not only do we collect biometrics from the various devices, blood pressure, weight, those types of things. There's also a way where you can interact with the patient and push back and forth education material. If they have questions on the disease state, or if there's information that you want to get to them, your benefit package, clinic hours, however you want to engage with the patient there. They can also do, we call it FaceTime on steroids. You can do a video call with the caregiver, with the physician, involve your family members. If your daughter wants to, like your, say your assisted living building and your daughter wants to interact with the care coordinator and be involved in that process. So you can do 3, 4, 5-way teleconferencing through the platform. You
Huh.
also can do what we call patient-reported outcomes, which is really surveys, or hey, I'm not feeling so great today. I took all my meds, and an hour later, I stood up and I felt really faint. Or I'm feeling much better today, and I'm going to cut back on my meds. Is that okay? Right? So there's ways to interact with the patients. You can do depression screening through the process if you want to use those types of surveys and have
Huh.
services to deal with that. So it's really more of a what we call a virtual care coordination platform
Mm-hmm.
versus remote patient monitoring, because we're doing much more than just the monitoring part of it. You could the medications parts in there, and medication adherence is a big issue, right? And making sure you're taking them, not only taking them and receiving them, taking them appropriately and consistently, and making sure that the big picture is there, that so that you don't end up taking all your Lasix at once and having an event, or skipping or you're out on your blood pressure medication because you feel good. So there's ways to interact with the patient beyond just the biometric measures that are coming in. So it's more of a, we try to say, a holistic approach to how the
Yep.
information is done by the care provider or the care coordinator, who can then help you action that information. Because a lot of time you can't see the forest when or you can see the trees, but you can't see the forest, right? So painting that whole picture enables the people that are involved with you and the patient themselves too, right? Like
Yeah.
our nutritional module, where you can access the data if you're counting calories and you're curious about how much that can of pork and beans was, calorie count or whatever, and you enter that data. Or we have the interface with a couple of the applications that kind of populates all that for you. All of a sudden your sodium is spiking again. And sodium
Yep.
is not great if you have CHF, right? Or if you're over your sugar or your carb limit, those kinds of things. When you can start to see that holistic picture, then you can intervene much easier. So we try
Yep.
to do that, but this is kind of the first screen that the patient sees when they come in, and then they can dive down into specifically. So on the RPM side, you can get in, you can actually kind of see what your current measures are, and then you can drill down over time to see kind of how you've been trending. But if you want to just look at a quick, sorry about that, a quick snapshot of, here's what I'm looking at, here's the various measures that I am participating in, and how we're doing, right?
These are the
The
key. These are the
application,
key measurement of the biometrics. These are the ones that whichever ones that the doctor has
right?
sent the devices out to monitor. This is what comes up.
monitor and measure, but also if you have an Apple Watch, you may be stepping on a weight scale and you may be monitoring your glucose or whatever. But if you have an Apple Watch, you can also hook in Apple Health into the application, and it'll bring over your step count and it'll bring over, some of that information also. And the
That's
screen
incredible.
here, it can be set up by also what the provider wants to make sure you see too, right? So there's input in the setup of when we set up with a new client, of what information that they want to do, and then the patient can select some also, and to do that. When we shift over to on the provider side, to the people that are involved with the care, really, they're looking at, and I explain this as a more of a population or a patient panel, right? You're
Yep.
looking at your patient as a whole, and the system sets up for alerts or people who haven't taken readings, or you set up your parameters and your care paths of what you're looking for, and it kind of alerts you to that, and then you can prioritize your workflow and your workload, and who to address and how to do that, and your normal coordinations to do that. So this screenshot is just of a patient panel that I'm working on, what the various issues are with them, how their readings are coming out, if there's anything that needs to be resolved or discussions, and then there's a little bit of a documentation portion too to how you capture that information for care delivery, for billing perspective, those information that you need that comes out of the system. But that's what, and then you can drill down. So you're looking at on this screenshot here is a patient panel that you're working
Yep.
with. On the next one is you drill down to that individual. How are you looking over time? What's going on with that measure? This one happens to be heart rate. How is your heart rate over time? And how it was looking at what's your blood pressure been over time? What's your weight over time? What was going on that created that spike in a certain period of time? Did you stop taking it for 3 or 4 days for some reason? And then all of a sudden, when you started retaking it, something changed in that. I started splitting my pills, for example, right? And you start seeing your blood pressure creep back up or something along those lines. So you can do it not only episodically, but trending over time. And trending over time is the power of the platform.
That's
That
right.
enables you to take that information and then act on it to intercede in that trend. So I like to say we're that leading indicator, right?
Yep.
We're the way to do that. So
Yeah, so if you
those,
see like if a doctor sees that blood pressure goes down every third day, and every third day their step counts up,
uh
then
yeah.
or whatever, they can draw correlations between those two as a result
You can
of that.
start looking to see, hey, there's some intervention going on here, or something has changed, and what was that? Both
Yep.
positively or negatively to do that, right? I switched to a generic versus a labeled brand. Did that affect me at all? Sometimes psychologically it does. The other times when you go back and say, no, it didn't at all. You know, especially in the geriatric population, hey, my pink pill turned to blue. Is it working just as well?
Right.
Yes, it is. Here it is, right now, and it costs you less, right? Or I up the dosage, and did I up the dosage over time? Is that having the effect I want to do? The power of this platform from a care coordination perspective is you can track it over time. The first thing that happens when we all go to the doctor's office is you step on the scale, they take your blood pressure, and they take your temperature, right?
Hmm.
That's only that one given point in time.
That's right.
Right. So, if you're anxious about, your blood pressure, or you've been not really following your nutritional levels or whatever, and it's up at that point in time and he decides to up the meds, but you're really pretty good compliant at home, that may be too much, or it may be reversed. But now when you have it over time, the doctor can look at that information and say, okay, here's the variables. Let's have a discussion about what's going on here, and here's how we're going to correct that or stay the course,
Right.
right?
Yep.
So that, and it also, from one of the powerful things about this is that, from an adherence perspective, if the providers and the care coordinators are involved with the patient on the engagement side, people tend to be extremely more compliant
Yep.
because my provider
Out
cares,
of sight, out of
right?
mind.
It doesn't have to be the doctor himself, but at the nurse in the office, or if I'm working with a care coordination disease management company and we're engaged in this, somebody's helping me. And then when I go in to talk to my doctor, He sees how I'm doing. He cares more about me as an individual, and there's somebody's actioning that information, and it makes it much more powerful. And we've seen, a couple of our various clients that have given reports back have shown that they can really move the needle. One of the use cases we talk about was up in Chicago with 127 patients. It was a really good SDOH study in that some of them were in affluent areas. The majority of them were in underserved areas in the inner city or in rural, outside of Cook County and Lake County, I think is the area they call it. Anyway, very small set of population. In 6 months, they dropped the ER utilization by 64%.
Wow.
Saved them about $2.4 million on the spend side, but also those patients didn't get admitted. They didn't go to the hospital. They
That's right.
stayed within that work. They were able to get ahead. And that was a lot of it was just getting that information, and the nurse coordinators that were working with these people who were already high utilizers and had a track record of high utilization. That engagement and that keeping them or getting them to the doctor, they actually saw an increase in physician visits, enabled them to stay out of the hospital, enabled them to stay out of the ER, produced a better outcome, and then people became snowballed and became more and more compliant using the system, right? So
What do you think, Steve? What do you think is the and I want to let you finish that thought, but what do you think is
yeah,
what causes this to work? Is there a psychology there from the patient's perspective that there's an accountability? Because right now, if I go, eat 3 cheesesteaks and drink a 6 pack of beer and smoke 30 cigarettes, my doctor is never going to know.
no, it doesn't
And
know.
all they're gonna know is that 6 months from now, when I go into the visit, they're gonna check my weight, and if that behavior persists, I'm gonna be up 10 pounds. My blood pressure is gonna be increased, or whatever it is. But do you think it's because there is an accountability, and they know that if there is a deviation from the norm, somebody's gonna call them and say, "Hey, what's going on?" Or what
I think
causes
it's
it to work?
both. I think it's both. From an individual's perspective, if you're doing this and you're compliant and you're using it, you're seeing the effects. You
Yeah,
know what you're doing, right?
people
These
want to get
are kind of
healthy. They want to be well.
yeah, this is kind of the outcome of that and if you're stepping on the scale every day, for example, and you start seeing it increase and increase up, you know that I'm eating a little much, or hey, I'm concerned about, maybe I need to up my Lasix, get on the phone and reach out and talk to somebody about that, right?
Yep.
If I'm doing that. So you've seen those incremental, so you're getting that feedback as an
Yeah.
individual, right? Now, as if now I've got somebody who's calling me, coaching me, participating, facilitating what's going on, and knows a little bit more about the disease state, and I can ask questions for, then I'm drawn into it more. From the provider side, I always use the word leading indicator, right?
Yeah.
Something's going on,
Yeah.
and there's multiple things that could be affecting this, right? But if I don't know something's going on, how do I intervene? How do I help? How do I go to them? Or sometimes it's just asking the question, and I just jokingly I use the sauerkraut because
Yeah.
that actually happened,
Yeah.
right?
Yep.
Well, how many days did you have sauerkraut? Well, I was working there and I was just munching on it the whole time I was there for 4 hours a day for a
Yep.
week,
Y-
you know. So you could intercede versus, the old way. I couldn't breathe anymore, couldn't walk across the room. I went to the ER. They gave me an IV of Lasix, and I got admitted for at least observation, or probably rolled over for a 3-day stay because I'm a Medicare beneficiary, and people were worried about liability and risk, right? You were
Yep.
able to get ahead of that. I didn't have to experience that as a person. I could see that myself. Now I know what to look for. So I think it makes it much more interactive. It gives people information, right? It gives them a way to see what's going on, and it lets it happen over time.
Yeah. And these, a lot of times, I mean, I noticed this just with, it's so difficult to get an appointment with physicians these days, and it's
Mhm.
difficult to get there. I mean, my doctor's 3 miles from me, 4 miles from me, but that might take me 25 minutes here in LA. And then it's you got to take time off of work and all that. And so a lot of times, even with me, the thought will cross my mind of, God, I should probably go get that looked at. but it's not actionable a lot of times
Yeah.
because out of inconvenience. So platforms like this are going to change the world. I'm
Yeah.
totally convinced of it.
It's
I
another
didn't mean
way
to
to.
cut you off
Okay.
on the result side of it, but that
Yeah.
was percolating on my head. I know there's a lot of psychologies to these things, and I know that it's not just people want to be well. I think they also need to be held accountable, and if they know somebody is going to call and check in on it, I think that might
Yeah.
even prevent. That's probably going to prevent bad behavior as a result.
Well,
Um,
I mean, you're trying to affect change
yep.
um, most of the
Disrupt.
time, or you're trying to reinforce. I don't like the word good behavior, but
Yep.
doing those things that are good for you, right? And giving people feedback and knowledge about it. Because if I think I'm doing okay on my diet or whatever, how do I know that?
Yep.
Well, you step on the scale every day, you get information, you get feedback, right? Well, what's the impetus for me to do that? Because I'm going to have a call with my care coordinator, because it's a benefit, but also we don't talk about this a whole lot either, but this is a benefit,
Yeah.
right? Because they're not paying for the equipment, right? Unless they do BYOD kind of a setup. The vast majority of our patients are provided this through either a benefit structure or an incentive program within a value-based program that they're trying to do that. So it's also a benefit to me. It gives me information. It gets me more involved. And when I have those productive conversations and somebody's checking on me, somebody's calling me every week or 2 weeks or whatever the periodicity is for my program, right? And I'm having conversations about myself, and everybody likes to talk about themselves,
Right.
right? Now I know, and I want to feel good. I want to feel better. I want to know that things are doing right, or I'll explain why I'm not doing it, or I don't think this is right, or this medication really, for the first week was good, but all of a sudden I'm not, something's off. There's
Yeah.
something different here, and I think I do need to talk to the doc. So then you can facilitate getting back into the network and back into your care delivery, and with actual information that can help people make decisions,
That's right.
right?
That's exactly what I was going to say. Was this facilitates or initiates an informed dialogue.
Right. A much more robust dialogue. And it gives you, and I go back to it's over time, right? It's not that
Hmm.
episodic, my blood pressure's up because I'm nervous about the doc because I don't want to hear bad news because I know I'm not feeling good,
Yeah.
right? Where over time I've been able to see this and here's what's going on and you can be more proactive. So, um,
Go back to where I cut you off there. Touch on some of the other metrics around that study and some of the improvements that you guys were able to show.
Yeah, within that study itself, there were some interesting things that came out that those people that did utilize the ER, and it was a much lower level of visit
Hmm.
on the ER. For those people who did get admitted into the hospital, was a much shorter length of stay, right? They were more focused on the thought process through that was you know more about what's going on individually, you know more about the direct cause that you're treating. There's less workup, there's less observation, there's less intervention, and you go right to the specific of it. There was less readmission, and I don't remember the exact number out of this one, less hospital readmission post discharge when they were on the platform. So,
All of which are right in line with what Obamacare was trying to drive with the Affordable Care Act: low readmissions, low early diagnosis, and
yeah,
that's where all the money is going to be going from
we
CMS is to drive all of those metrics.
we have and every time I say this, people don't believe me, but we have a home health company in the southeast that's been had people on the platform for over 2 years now. Their readmission rate is less than half of 1%.
Wow.
And when you look at that, first time I heard that, I said, please go back and do the math again. That,
Right.
are you guys serious with this? And but it's really the full scale, the engagement that they utilize. They're proactive in working on the care with the patient on a pretty high risk population, right?
Yeah.
So they're able, and they're the ones who really use this as leading indicators. Who then, do I send the nurse out for a home visit? Do you come in for a visit? Hey, let's go to the ER and get this immediate issue addressed,
Yep.
right? So it makes them much more proactive. So we see, the lower hospitalization rates, lower readmission rates, lower ER utilization rates. And conversely, you'll see a higher engagement with primary care and specialists, because specialists also use the platform,
Mm-hmm.
right? If they're worried about somebody who's crushed whatever threshold for CHF or COPD is what we're seeing more and more. There's more and more use cases developed around that, right? It enables them to be proactive, and now not only is the specialist getting the information, or can be doing that, but the primary care is too. So that real true coordination starts to happen, and it's not so siloed. Where I think as we see more and more of the home focus and services in the home, there's a risk for being more siloed, right?
Mm-hmm.
The only way to get over that is communication and technology, right? And the flow of data. And we're interoperable with EMRs. We're able to push information to them as they need it. They can get into the televideo conferencing is a big capability, and used a lot more than we originally thought it was going to be with the care coordinators. They
Sure.
actually call them that way versus picking up the telephone and calling.
Yeah, absolutely. Yeah, because a lot gets missed with just voice, right? If you can see, you can see if somebody looks lethargic
Yeah.
over a video call. We touched on a lot of the patient and physician clinical benefits. What from a from a practice and a revenue standpoint and a provider standpoint, share, I know, obviously, in the ACO environment, they're they get compensated based on the quality of care that they're providing, and not just ACOs. There's a lot of different um,
Yeah.
practices that are set up like that. What are the benefits, to the providers in using this outside of beyond just the clinical side? And one specific question is I know there's still a lot of physicians, especially in a lot of these rural areas, that aren't even using an EHR. So that's they get a 10% dock in their reimbursements right away. Can they capture that using this?
Yeah, so if you look at from a payment perspective, right, there's two worlds. There's the value-based world and then the fee-for-service world.
Yep.
And in the fee-for-service world, and COVID really accelerated this, was the acceptance of RPM and care coordination and the incentives for the physicians to actually start being able to provide that service line within their
Mm-hmm.
practices and get reimbursed for it. So there's CPT codes now for all of those services, both for remote patient monitoring, PCM, which is actively involved after a discharge, remote therapies now, where people can to bill for some of the RTM codes that are out there. So
Yep.
there's a revenue stream and a service line now for the physicians to do and perform, where before, especially on the chronic care side, they weren't getting reimbursed for.
Yep.
So your average primary care of a physician panel that has 3 or 4 thousand patients, 1,000 to 2,000 of them will qualify for the chronic care, right?
Yep.
And there's the CPT codes for that, and it's a revenue stream for the physician. They're compensated for proactively managing the patient now, right? Where beforehand, and I don't remember the exact time frame that the CPT codes came off, but they've been added to every year. And then COVID really pushed that and accelerated that, and accelerated the adoption of it.
Mm-hmm. Yep. Yeah.
Yeah.
It's been refreshing to see. I know they're trying to, in certain ways roll some of that back, but I think the genie's out of the bottle in a lot of respects, and I don't think it's going back in, and I think it's a
Well,
great thing.
yeah, it's not, because insurance plans are now writing benefit structures for it,
Right.
right?
Yep.
And people, and as you know, more and more care is being pushed towards the home, the reimbursement streams follow that, right?
That's
Or
right.
initiate that in some cases. So when you start seeing commercial benefit plans written that have some kind of benefit structure around receiving, whether it's telemedicine, remote monitoring, care coordination, the plans know that in the end it saves them,
Yep.
right? It bends the cost curve so that it's a benefit that's worth paying for,
Yeah.
and consumers want it, right?
That's right.
We all went through COVID, and even though at first we were a little hesitant of the telemedicine visit, right? And using that technology, most people kind of like it now,
Yep.
you know. And
100%.
when my employee plan covers it, I'm gonna do that. Medicare is structured that to do that. They want to see more and more doing that. So those incentives are really starting to align. The reimbursement streams are aligned. The technology is there. The broadband connections are there. The service providers are now working on their workflows to how to integrate that into their practices. And it's really starting to snowball, and especially within the last year and a half,
Yeah.
it's really
Yeah.
started to come along.
We you and I talked at JPM and talked about this, and I think the biggest theme that I saw coming out of that meeting was transition of care from the acute care setting to the home, and that was, and I don't even remember what number 2 was. That's how prominent of
Yeah,
a theme that was. So, you guys are definitely smack dab in the middle of a hot space. I want to be sensitive to your time here. I want to get you out of here as planned.
sure.
But last question. So commercially, this is obviously commercially available if in a SaaS model. Question I have for you is, if a patient wants, if like let's say I wanted to get this for my parents, does the physician already have to be set up for them to be able to access this, or can my father go to his doctor, his primary care, and say, hey, I want to utilize this program? That's question number 1. And then question number 2 is can multiple specialists, like can the GP and or the internist and the cardiologist and the pulmonologist all have access to the platform?
So, two questions. The
Yep.
We're predominantly, not predominantly, we're 100% business to business. So the
Yep.
practice would enroll in the solution. The hospital health systems are big clients for us. The payer market is, we're starting to do more on the payer side for population health management. So for our platform, that's mostly how people access it,
Yep.
right? You can go and download the app. The app's free, and hook up your own devices. But for your providers and the network to become involved, they would have to be enrolled as a client for us. So that's the commercial side of how we engage the market, and
Yep.
that's who we work with. Our clients, though the patients receive the benefit and are doing that, our clients are actually the providers or the care coordination companies that are using the platform to deliver their service.
So there's an
Right?
incentive
To
for
do
the
that.
patients to go see physicians that are providing this as a value add to their patients.
Hmm. Yeah.
Yeah.
Yeah, that would, yes. For the multiple physicians to engage and do that, you can do that through video conferencing, or depending upon how the physicians, if they're in a network and through their EMRs, is usually how they exchange information and data to
Yep.
get there. They would actually access the platform doing it that way.
Got it. Got it. Yeah, no, it's incredible, man. I think you guys have definitely got a bright future, and look forward to watching the trajectory of the company moving forward here. Steve, really appreciate you taking the time to come on. Always a pleasure to get some time with you and chop it up a little bit, and really appreciate the deep dive into the technology. Anybody that's interested in potentially hearing more about the technology or potentially even working there, we'll make sure Steve's email and info is in the show notes, as well as any other information that might be relevant. But thanks again for coming on, Steve. Really appreciate it, and wishing you guys continued success.
Yeah, thanks for the time. I appreciate it, and it's an exciting part of healthcare to be in now. It's a lot of fun. A lot of
It
fun.
really
So,
is.
yeah.
Well, that's it for this episode of The Bleeding Edge. Appreciate you tuning in, and we'll look forward to catching up with you guys next time.